will give the area an important balance between open space and development. A public meeting will be held tonight at St. George's Church on Piccadilly Avenue. An Ottawa medical research team has been awarded $1.4 million for a project that could prevent blindness. The study is led by Dr. Catherine Silfides, a senior scientist at the Ottawa Hospital Research Institute. Doctor, good afternoon to you.
Good afternoon.
Can you give us an idea in layman's terms what kind of therapy you're trying to develop and who it will help?
Well, our research is aimed at blinding disorders. We are trying to prevent progression of the disease in a number of diseases that cause blindness, such as retinitis pigmentosa, glaucoma, retinal ischemia, which is a mini stroke in the eye, and retinal detachment. This grant that we've obtained is a 5-year grant that will help to advance our research program to the point where we hope to introduce it into the clinic.
It's a form of gene therapy, correct?
Yes, absolutely. So the gene that we are working with is basically a survival factor, and it targets one of the common pathways for many forms of blindness, which is that the cells in the retina die by a process called apoptosis. And this survival factor, when introduced into these cells, prevents them from actually going through the death pathway. So in this way we can save these cells and hopefully stop the progression of the blinding disease.
So just so I understand this right, so will there be some blindness left in these individuals providing this works down the line as you do the research, or will it prevent it to a point where there will be no blindness at all?
Well, so this gene therapy will not reverse disease where blindness has already occurred. So basically the best that it can do is it can stop progression of the disease. So when these patients come to us, once this therapy is in the clinic, they will be able to preserve the remaining vision. And for a lot of these patients, that's still significant impact on quality of life. Because many of these diseases can be diagnosed relatively early in the disease process.
Doctor, just a few seconds left. It's a 5-year grant. How long will it take for you to get some real results?
Well, we've been actually working on this project for 10 years. The next 5 years with this grant will allow both our group here at the Ottawa Hospital Research Institute and our collaborators at the University of Florida and University of Michigan. It will allow us to get to the point where we will do all of the experiments necessary to start phase 1 clinical trials in patients.
All right, Doctor, fascinating work. Thank you for sharing it with us. We'll follow it as the years goes on. Thank you so much.
Thank you very much for having me.
Well, the West Ottawa community of Bell's Corners is looking for a facelift. Once a historic hub with fine dining, shopping, and nightlife, its main strip is now considered an eyesore. CTV's Jonathan Rotondo has more on the new vision.
20 years ago, Bell's Corners was a destination.